talking about the heart pericardial effusion so that you have an idea now. Remember the topic, I hope Dr. Lanao was able to talk about the pleura. Di ba na-mention siya pleura? I hope we discuss it ngayon. The pleura, actually, if you notice, if you touch it, parietal pleura, you have the four parts, right? You have the costal, the diaphragmatic, mediastinal, and the one, if it's in the apex of the lung, that is what we call the apical cap or suprapleural membrane. Correct? Now take note that the pleura covers practically the right side of the mediastinum or the right lung, lateral compartment. Now also, if you go to the left, there is what we call as the bare area. Did he mention this one? Now the bare area, actually, if I'm going to follow the red light, the laser here, the pleura on the left goes down here, mediastinal, then deviates. Unlike the right, where it goes straight down. The left deviates. What makes the pleura deviate at the left? Because of the heart, especially the LV. And that is the reason why you have the cardiac impression forming the part of the inferior lobe of the left lung. Now, there is a very, very important reason significance. That's the reason why when we do any future procedures, you should know where to go. Because that particular bare area, now I'm giving you an example right now of the pericardial effusion patient. I mentioned to you a little while ago that the best treatment for pericardial effusion is what? Just poke the needle, then aspirate. If you remove at least 30 cc, your patient will wake up. One patient in distress, then when you just poke a needle, the patient will be fine. And everybody will say, hallelujah, hallelujah. But the question now is, you don't just poke your needle anywhere. Imagine, if you poke your needle anywhere here, because anyway, the pericardial effusion is this one. So if I pump my needle straight up here, true, no, not tayo. You can still get the fluid because it's all the way up here. But the problem there is you penetrated the pleura. So what happens to the patient? Nakakuha ng fluid, correct, but nag-pneumothorax ka. So meaning, relieve siya sa usa, balik na sa usa. And the treatment for pneumothorax, you cannot poke a needle, you have to place a chest tube in place. So it compounds the problem. And the reason why you have that pleura, because we are in correlation with the case of the pericardial effusion, is you have that deflection, which is the bare area of that area. Meaning, the area from around the 5th or 4th intercostal space, deviating towards the left, is devoid of pleura. So the point here is that the safest area to poke your needle for patients with pericardial effusion or tamponade is the area here. Because you don't expect any pleura there. So when you poke your needle, secondly, it should be below the xiphoid process. You know already the xiphoid process, correct? It should be directed, the needle should be directed here, correct? Then it's straight. Dito kas chamber, right? So it should be going up here, right? Because the direction of the pleura deflected is here. So make sure lang it's a 45-degree angle and the direction of the needle should be at the left shoulder. So when you poke it, you can feel the resistance. And then when you poke it na at the resistance, you can see blood or fluid, relieve direction. You stop. If you can aspirate fluid, you don't go further. You stop. And you don't evacuate everything in one sitting. 10 cc at first, then stop. You can control it, annulate, then stop, then another 10 cc. Just like massive pleural effusion. You don't just insert a chest tube there and leave it alone. Patay ang pasyente. Because what we call a reverse pulmonary edema. You have to increment mode back 200 cc clamp. Take it at rest. Then you remove again the clamp, bring out oxygen. You have to do it transitionally. Just like here. This is a life-saving procedure. We do this in tamponade, but we rarely see tamponades, meaning from trauma. Panagsara kayo. Because most of the time when the heart is injured, okay? 15 minutes, tamponade restrictive. But this is very common in some, if you want to be safe, some would attach the needle with an EKG, electrodes. Okay, so when you touch the portion of the pericardium, muana ng electrode. So if you want to be safe, muana ng electrode, meaning you are in the area of, because again, the pericardium in the heart it needs electrical activity. And that's the reason why heart, because of the nerve conduction, the only way to diagnose arrhythmias is take an EKG. EKG is purely electrical. That's why mamong EKG, right? It's electrical. So na electrical ang heart actually. So that's why ma-reflect siya sa kanan. It's the best way to have a baseline for arrhythmias. That's another problem sa heart. We were talking about congenital heart, valvular heart, coronary, lahi sa ng arrhythmia. And you can actually die from arrhythmias also. Okay? So lahi sa ng sakit, that is from the nerve from the heart. The heart is a very important organ, but it has also the most number of diseases and death. Diba? So, take it for a week, manalaman siya. Okay? Any questions? Before you take your Santos lunch, I can apologize for being late anyway, nag-make up naman. Ako na mag-estimate ang time. The topics is not that long. By the way, for next week, if the lecture, the coronaries and the veins is not that long. If you finish by 10, do not go home and wait and lunch. If possible, you go down. As what we agreed, di ba? If our topic is short, but we have to follow the system schedules. I cannot, except for the fundamentals, I cannot jump to urinary and ahead. But if, for example, if the topic on coronaries, if I give the lecture, it's not that long. The vessels, the branches, cardiac veins, and the nerve conduction, if you correlate it with the EKG. If you have enough time, let us say you finish from 10, if you start on time, then you go down. Take advantage of the time. Okay? I know every Tuesday is taking exam, you have now started with SGD. Correct? SGD na mo, busy na. And if I look at your schedule, there are only very few Tuesdays where you don't have an exam. So welcome na din mo sa medicine. Okay? I was looking at your schedule Tuesday. Wag na kayo, sara kayo Tuesday wa exam. Then you have already started your SGD. So now you have the lab. So take advantage of a short lecture. You go down and take a look at the hearts there. Or if you want to review the respiratory, because we're still going to have one more lab left for the cardio. Take note that the first practical will be both respiratory and cardiovascular. Okay? Sige, go na. Both. I cannot give an example per system. It's too few. I need both. As what we agreed in orientation, I was good for 2 systems before I give my practical exam. Except for alimentary tract and musculoskeletal. These are the only 2 systems where we have to give an exam after each system because the coverage is so long. Okay, we have to finish 4 weeks, so that's good enough for one system. Sige, okay na mo? Sige, where is the attendance? Nawa na, Joel, asa naman ka Joel? Mukha na lang yun akong lecture, asa na si... Okay lang mong napin. Joel is dead. Okay. Sige guys, you can go dismiss. I just did the attendance.